We are really excited to enter into a partnership with Darumbal Community Youth Services. Their philosophy on working with children and families really aligns with our view of families of these kids, and I guess that if I were to characterize the alignment, one of them would be that we really believe in the families that we work with, and I would say that belief isn't really sort of idle talk. That the belief we have in families has been borne out by our data in terms of the kind of changes that families are capable of making. But yeah, I think that the partnership itself is intended to bring together two kind of organizations whose philosophies align quite well, and kind of pool our forces to try to help families peg back some kids who are kind of getting off the straight and narrow, who are engaging in disruptive, even highly disruptive behavior that can include kind of youth offending stuff. Our initial partnership agreement is a first step in a number of conversations that we're having about exactly how this partnership is going to play out. But one thing I can tell you is we are going to be carrying out intervention, therapy with families, where we assist probably in training and looking after therapists from Darumbal, who will be perhaps going into family homes and looking after families using elements of our program. So that's certainly one way forward for that partnership. The actual details of training and supervision and the like is really going to be part of a conversation that we're continuing to have as we put kind of pen to paper around the real specifics of that partnership agreement. We have a program that is based on the evidence. So we developed this program based on other programs that are out there, with some enhancements we'd like to think, but also in terms of the data that we've collected since last October, since starting this program, I think have been sufficient to give us some quiet confidence that as we start to take it on the road and use it through a service, say like Darumbal, and help them hew it and help it fit the families that they work with, that it can produce some of the same sort of gains. One of the qualifying criteria for our program is actually this idea of conduct disorder, and the defining theme in conduct disorder is violating other people's rights and violating major societal norms. So it's getting up to not just kind of naughty behavior, but quite naughty behavior. So, you know, it's around things around aggression, not going to school, offending kinds of behaviors, running away from home, hanging out with peer groups that really are leading that young person down a bad path, so those sorts of things. Our job is first to help understand what the problems are that the family is seeing for their young person. But once we get a sense for what the problems are, we also then start to try to help understand what the family's strengths are, both through asking them about what their strengths are, but also by being able to watch and observe their strengths as we go into the family home. As we start to get a better idea of the strengths are the initial pathway through which we have strategies available that can then be applied to the problems that young person has. So ours is a program that really quite explicitly focuses on family strengths and what we call family solutions. So the family strengths are the first step on the road to applying the strategies that we have to offer. The strategies that we have to offer are aimed at the major kind of risk factors for antisocial outcomes. And those risk factors are risk factor number one for kids, in terms of what factor produces the biggest risk for antisocial outcomes, is spending time with peers who are leading that child down some bad garden path. And that in any study you look at, Australia internationally, it is really the most robust, powerful risk factor. So we look at the peer groups they spend time with, but we also look at things like parental monitoring and supervision. That's quite an important one. The parents knowing where their kids are, knowing who they're spending time with, having ground rules for you can spend time with these kids, but you can't spend time with these kids. And then also the factors within the family home around discipline strategies, behavior management strategies, helping increase positive behaviors and decrease irresponsible conduct disorder, disruptive behaviors. And then finally, what we like to call in our little program the warmth and affection factor, so the positive parent-child interaction. So those 4 different factors are 4 that the research has shown are really quite important, certainly for the kind of kids that we work with, but I would also suggest they're quite important for most kids anyway.